The human body's functions are stimulated and excited by movement. For example, when we move, our brain, our heart, our lungs, our nerves, our blood vessels, our eyes, our ears, and our digestion, every system which is required for us to have physical harmony is stimulated and made to work. So as an orthopedic surgeon who has a special interest in sports medicine, I believe and I hope that I will use my skills in order to help you move better and without pain. I believe that information about a problem or a disease is the first step that we take towards beating the problem or that disease, and the Saturday Ortho show is going to be all about that. That said, nothing is complete without a COVID update, and at the end of the show I will also have a very interesting COVID update for you. Getting straight into the show. The show is going to have 4 parts. The first part will be my motivation. Why was I inspired to make this video about this problem? And then I will be talking about sacroiliitis, which is today's topic. After that, we will move on to what are the metals which are used inside our body, especially if you're somebody who's had a plate inside you or you've had a joint replacement. You definitely want to know something about the metals. And finally, yes, of course, the COVID update. A couple of weeks ago, I met a 34-year-old young mother. Young in the sense she had just delivered a baby 9 days ago. When she met me, she was in severe pain. She had low back pain and she was unable to even move from the hospital trolley onto the bed. We had to have help in order to shift her. She had that severe pain that all investigations were done, and even after we gave her a very good dose of painkillers, her pain did not subside. As we did an MRI of her spine, because when somebody is pregnant and they have low back pain or pain in that area, 7 out of 10 times it is from the disc or from the spine. So we did an MRI of the spine, and the MRI of the spine also showed some kind of inflammation at L4 and L5, which is lumbar levels 4 and lumbar levels 5 of the lower back. Then we treated her for that problem with an epidural injection of platelet-rich plasma, and we also gave a nerve root block in the spine. Her pain subsided for a day, but then it flared up again. And this time I was forced to think what else it could be. And then we decided to investigate for a sacroiliac cause of pain. We did the MRI, and the MRI showed some signs of inflammation. It was not very obvious, and so we had to do something known as a sacroiliac joint injection to identify if her pain arose from that region. And the sacroiliac joint injection was positive, and we were able to treat her successfully for her sacroiliitis. And I immediately wondered how many patients who have sacroiliitis are still suffering and are treating themselves for low backache. And this video will be a very simple way with which you as a patient are empowered to identify if you have sacroiliitis or not. Coming to the characters or how sacroiliitis or pain in the sacroiliac joint actually feels. It's a stabbing pain. It's there when you sit, when you stand. Especially the pain aggravates when you transition from sitting to standing. The pain can be there even when you are lying down. The pain always is aggravated by weight bearing. The pain can radiate up to the thigh, sometimes to the knee, and it also spreads to the buttock region. And finally, the pain reduces a little bit when you move to one side. Oh my God, these symptoms are so specific. Why do we get confused? We get confused because there is another disease known as a disc bulge or a disc protrusion which has almost the same symptoms. The pain arises from the region of L4, L5, which is very close to the sacroiliac region. The pain could be aggravated by walking, sitting, lying down, weight bearing, and also the pain radiates to the buttocks, the thighs, the knees, and it sometimes even proceeds down to affect the foot. And this is the reason why we are so confused whether it is a sacroiliitis or it is a pain arising from the disc. So let's understand anatomically why this happens. Trust me, it's very simple. So if you look at this here, this is your L4 and L5, this is your sacrum, and these two are your ilium bones, and this joint here is your sacroiliac joint. So if you see carefully, this entire area is very close together, and all the nerves which come from L4, L5 and S1 pass down through this sacroiliac region, and that is why the symptoms of a disc problem and a sacroiliitis are very, very similar. So if you're wondering how, as a layperson, you're going to identify a problem which is confusing to professionals, no, you're not going to identify it, but you're going to help yourself and help the doctor who is treating you to identify it if it is sacroiliitis. So first, think of the history. Did you have any trauma or injury to your sacroiliac region? 2. Have you had any spinal surgeries in the past, especially fusions of the spine? Do you have a history of inflammatory arthritis like ankylosing spondylitis or rheumatoid arthritis in the family? 4. Have you had any history of bone issues like rickets or osteomalacia? These are diseases which occur because of deficiency of calcium and vitamin D. Finally, think. If you're somebody who's just gone through a delivery, was it a difficult delivery or not? If any of these 5 clues are positive, please tell your doctor that it is so. What are the tests which you can do to tilt the diagnosis towards sacroiliitis? There are a lot of tests, but these are provocative tests, and I advise these to be done only under the presence of a clinician. The 2 simple clues are, if your pain is not proceeding beyond the knee, then there is a possibility that it could be sacroiliitis, because pain from the disc can even reach your foot. The second clue is, if you're having sacroiliac pain, then if you turn to the side and if somebody applies gentle compression on your hip region, your pain will improve. These are not definite tests, but these are definitely clues which lean towards sacroiliitis. Now, okay, if you go to a doctor, what are the systems that they are supposed to examine to make sure that you have or do not have sacroiliitis? You definitely have to examine the spinal system, the neurological system, the sacroiliac joint. Make sure that the provocative tests are done. Third, you have to examine both the hip joints also. But what is actually the gold standard? Yes, we do an MRI, we do a CT scan, but the gold standard is you have to identify the sacroiliac joint and inject around 2 ml of local anesthetic right into the joint. If the patient's symptoms reduce by more than 60 to 70% within half an hour, then it is a positive for a sacroiliac joint problem. So the gold standard, sacroiliac joint injection. Now let's focus on treatment. If we are sure that you have a sacroiliac joint pain, then the first thing we do is to assess your gait, the way you sit, the way you're able to do your activities. And based on that assessment, we prescribe you physiotherapy exercises for strengthening your hip, your glutes, your core, and your pelvic muscles. Many times this helps. Then there are medications which are anti-inflammatory medications, and also supplements if you have an issue because of deficiencies like rickets or osteomalacia. The main treatment though would be an injection inside the sacroiliac joint. What injection is administered can be different Steroids are used in a few centers. Prolotherapy is also used, but we use injections of platelet-rich plasma which are harvested from the patient's own blood in order to get the anti-inflammatory effect and reduce pain of sacroiliitis. And this is done using ultrasound and fluoroscopy, that is live X-ray imaging, so that we do not miss the sacroiliac joint. And if all this fails, we can stabilize the sacroiliac joint using surgery and your pain will get better. Now that we have covered everything about the sacroiliac joint, let's go to something which some of you, if you've had an orthopedic surgery for a fracture, you might have inside you. That is the metals which we use when we fix somebody's fractures with plates and screws, or when we replace somebody's joints. Most probably, if you had an implant inside you in the last 5 to 10 years, it has been titanium. So why titanium? It is an alloy, it is non-reactive, it is easy to procure, it is easy to design with, it does not get oxidized, it stays without irritating the human body for more than 20 years. Titanium is also MRI compatible, so unlike stainless steel, you can do an MRI if you have a titanium implant inside you. And this is why, guys, titanium is quite cool. I'm really excited to tell all of you guys that India has approved its first DNA vaccine. It is a 3-dose vaccine and it has shown 67% efficacy in trials with a sample size of 28,000. Another attractive thing about this vaccine is that it is not an injectable form of a vaccine, but it is sent as a puff of fluid just underneath your skin. And studies are also showing that it is safe to give in 12 to 18-year-olds. Alright guys, thank you so much for watching the show. Please like, subscribe and share. If you found the information useful, let me know, because it really helps me to produce you with information which appeals to you. Signing off from the beautiful city of Chennai in Tamil Nadu, Dr. Santhosh Jacob from the Saturday Ortho Show.